Hello, and thank you for tuning in to my YouTube channel. I greatly appreciate it. My name is Dr. Cameron Mercarimi, and today is going to be the first of many videos that I will be posting to talk a little bit about my product, Pocketglove, and what its role will be and currently is in helping prevent the spread of highly contagious infection diseases, particularly at this time where we're dealing with the coronavirus COVID-19 pandemic. A little bit about myself. I am a board certified internist currently practicing hospital medicine in San Diego, California. And I came up with this product in 2014. Around that time, there was an article published in the Mayo Clinic Journal, which indicated that stethoscopes, particularly the diaphragm of the stethoscopes, are highly contaminated and means for potential ways of transmitting contagious infectious diseases such as C. diff, MRSA, around the hospitals from patients to patients. Around that time, I'd already been working on coming up with a solution to help with infection control at my hospital. Being a hospitalist, we gown up and go into rooms that are isolated on a daily basis. And just the background on how I came up with this product, for those of you who aren't familiar, several rooms in the hospital wards can be isolated and are isolated for patients who are carrying organisms, highly infectious organisms, multi-drug resistant organisms, some which you may be familiar with, C. diff, Clostridium difficile, or MRSA, tuberculosis, and that nature. And in these rooms, these patients are isolated, as are the patients that are currently in our situation being ruled out for COVID-19. And they are in rooms where physicians, nurses, hospital staff entering these rooms, they need to wear a gown, they need to wear gloves, and usually use a stethoscope in the room, which is usually yellow, but a toy-like stethoscope such as this. And unfortunately, these stethoscopes aren't the greatest at hearing patients' hearts and lungs, but in these isolation rooms, they highly encourage us to use these stethoscopes. And the reason I actually came up with this product, Pocketglove, is I'm not a big fan, as are not a lot of the infection disease doctors in our hospitals are using these stethoscopes. And what usually, in this case, other options are to use your own stethoscope and wipe it down when you leave the patient's room, which, we're not the greatest of doing so, or wearing gloves and wrapping a glove around the head of the stethoscope to prevent transmitting, from patient to patient. And I thought that was a bit cumbersome, and to help prevent this, I came up with a product called Pocketglove, and that's what I'll be discussing here further. So Pocketglove is your normal medical exam glove, which is made out of nitrile, which is the gloves currently we are using in our hospital and hospital systems when we need to examine patients and go into their rooms. The glove I created is a bit different, and I will explain that differently here. Is that one, it's green, not your typical color, but I created a pouch, and that's what I'll be demonstrating in this video and videos to come, and how I believe this will help prevent the spread of highly contagious superbugs, as we like to call them in the hospital. And I'll be demonstrating that now. So this is a glove just like any other glove, which we will be demonstrating here, and I'll be putting it on here. However, as you can see, this glove is a little bit different. There's a little slit on this side, and there's a little slit on this side. It can be used as a normal glove, so you can go into the patient's room and examine the patient, and it's disposable, where you can take it off and throw it away. However, because of the stethoscope potential contamination, I created a pouch in this glove for which before we enter the patient's room, we can insert our stethoscope head. So imagine I am gowning up, getting ready to go into a patient's room. I have worn my gown, I am gloving up, and now I want to enter the patient's room, but I'm worried about my stethoscope, the diaphragm, which is this part right here, which studies have shown is the most contagious part of the physician's, nurse's stethoscope. So therefore, we created the pocket glove where before you enter the patient's room, as you can see, this little pouch kind of dangles out like this. And as part of our donning and gowning procedure, you slide the patient's your stethoscope into this little pouch here. Now I'm ready to enter the patient's room, open the door. I'm discussing with the patient how they're doing. I'm ready to examine the patient, and therefore I grab my stethoscope, listen to the patient's heart, patient's lung. Stethoscope is off, diaphragm is covered. I've examined the patient. Remove my glove. Disposed of that, disposed of the gown, and ready to see the next patient. Obviously, we still recommend that when physicians leave the patient's room, that they wipe down their stethoscope either with alcohol, with cavi wipes that are usually outside the patient's rooms that are being isolated. So this will be one of many videos I will be posting to initiate this YouTube channel, really as an informative channel on how I believe a pocket glove can assist in helping infection control in general in our healthcare system, helping prevent the spread of nosocomial, which are healthcare related infections, and overall save healthcare costs and patient lives. Specifically with the current pandemic, there's a shortage of supplies going around, as we've been hearing in the news, on gowns, masks, and gloves. And I'm happy to say that this glove of mine, pocket glove, can add to the current, add to the inventory or to supplies during this time of shortage. So Pocket Glove, www.pocketglove.com is my website. I will also be posting links on this website showing and referring to the two articles that have been published. The initial one was in the Mayo Clinic, published 2014, demonstrating how highly contaminated our diaphragms of our stethoscopes are. And for any questions, please feel free to contact me. My contact information will be listed below. And I would appreciate if you like and subscribe to this channel. Thank you very much for watching, and I look forward to adding more videos in the near future. Thank you.